discuss how to expand the global manufacturing and research hub. The final outcomes of these meetings are expected to come out within the designated time frame, so hopefully we can finalize on the second Health and Finance Ministers meeting on October, just 1 month before a G20 leaders meeting on November. We also have held G20 side events on tuberculosis and One Health, back to back with the first and the second health working group, respectively, while the last one on antimicrobial resistance will be held in August with the third health working group in Bali. Ladies and gentlemen, Taman Sari was built during normal time, not only to be used for its day. Now I wish to invite our Troika colleague to deliver their opening speech for today's meeting. First, our friend from Italy, Deputy Minister of Health, Mr. Davide La Cecilia. Because the minister conveyed his personal message to me, he couldn't come because of the BA4 that attacking not only Italy, but also some of the key person in Italy. So you may have the screen to give a 5 minutes remarks. Please, Mr. David.
Good day to everybody. Thank you very much, Minister Sadikin, for giving us an overview of the priorities of this G20 ministerial meeting and for the leadership provided by the Indonesian presidency in guiding us through the issues of global relevance with a strongly operational approach, which is in line with that of the Italian presidency last year. You have our full support. At the outset, let me express full solidarity with Ukraine and Ukrainian people. Italy condemns in the strongest possible terms Russia's unprovoked and unjustified military aggression against Ukraine, which grossly violates international law and the UN Charter and undermines international security and stability. We reiterate our constant call on Russia to put an end to the war it started and to the suffering and loss of life it continues to cause. We underscore the significant disruption of the Ukrainian health system caused by the Russian war. Russia also needs to stop its disinformation campaign and cyber attacks. Italy agrees with the priorities set out by the Indonesian presidency. First of all, we have to work on the global health architecture, keeping the WHO at its center. COVID taught us that health systems at every level must be resilient if we want to withstand a major sanitary crisis. We cannot win alone against the pandemic, and therefore we need international coordination. Important steps forwards in our partnership are requested. In the financial area, the G20 need to contribute through a financial intermediary fund to fill the existing gaps in health emergency preparation, prevention, and response that we have identified through the work of the task force co-chaired by Indonesia and Italy. I also think that the task force should evolve into a more permanent platform for coordination to be placed at WHO. In terms of countermeasures, we need to build on the previous experience and enhance those mechanisms that have allowed us a more equitable and effective access to BTDs, particularly COVAX. A better distribution of vaccines also means building hubs for their production in other areas of the world, since 80% of them come from a very limited number of countries. The commitment of the WHO and the EU towards Africa is the first step in the right direction, but we need to enhance production in other regions of the world. One of the dilemmas we have faced over the past 2 years has been how to ensure the normal functioning of economic and commercial activities, including movement of people and goods, despite COVID, which at the beginning was an unknown and very frightening pandemic. Whole history of prevention and closer inspection can be seen in terms of the search of a trade-off between health security and the attempt to keep the economy alive, preserving trade and relations between people. The development of a universal protocol for mobility suggested by the Indonesian proposal is therefore vital. The work done by WHO on one side and the EU on the other appears to be a good starting point. Here, as in many other dimensions, the lesson to be learned is that of multilateralism and harmonization. Also, in terms of prevention, we've seen the best results depend on our activity of genomic sequencing in order to identify new variants as soon as possible and to exchange data through platforms that safeguard the work of scientists. This also seems to be a very useful indication of work. I look forward to a fruitful discussion in the next couple of days, and thank you for your attention.
Thank you, Italy. Now to my colleague from India, another Troika member, Minister Mandavia. You may have the screen, please.
Thank you, Excellency, Mr. Budi Gunani Siddiqui, Honorable Health Minister of Indonesia, Excellency, Mr. Roberto Speranza, Honorable Health Minister of Italy, fellow ministerial colleagues from G20 countries, Dr. Tedros, Director General WHO, distinguished colleagues and delegates. From greeting to you all at the outset, as part of Troika, I would like to welcome all of you to the first G20 Health Minister meeting under Indonesian presidency, a Yogyakarta. India congratulates Indonesia for hosting two successful health working group meetings in Yogyakarta and Lombok, where in priority issues of harmonizing global health protocol standards and building global health system resilience were discussed and deliberated upon. And I would also like to thank Indonesian presidency for prioritizing the issue of tuberculosis and One Health and for the successful conduct of side event on the issue. Dear colleagues, we should all be glad that with an ongoing reduced trajectory COVID-19 case across the world, we are meeting with a hope that the end of the current pandemic appears near. The ongoing pandemic has posed multiple challenges on the health system across the globe, developed and developing countries alike. The present pandemic has highlighted the fault line in the global health governance and has brought to fore the importance of strengthening global health architecture. It has reinforced the need to assess health ecosystems, health financing, and their linkage in light of the experience in managing the current pandemic. The collective challenge across the world today is that this may not be last public health emergency which we may have to face, and hence the need for an inclusive, agile, and responsive framework for health emergency management, supported by a global mechanism of surveillance, sustainable financing, and equitable distributions of medical countermeasures. G20 countries account of 80% of the world's GDP and shares 80% of global cross-border trade, and hence G20's engagement and leadership will be vital strengthen the global health architecture and management of any future health emergencies. India would, however, like to highlight that the proposal discussed during the 75th World Health Assembly regarding strengthening global health architecture should be factored in the discussion at G20 level to avoid any fragmentation and duplicacy. India strongly believes in the centrality of the WHO as a member state driven process in global health reforms and believes that there is an urgent need for bringing transparency, accountability in WHO functioning so as to make WHO fit for purpose besides the need to work toward financial sustainability of WHO. Excellency, in a pandemic, no one is safe until everyone is safe. India believes that we should strive to build global health resilience besides working towards mutual recognition of vaccine credential to aid seamless cross-border travel and the need for expanding research network, mRNA manufacturing hubs, and distributed manufacturing of medical countermeasures, with particular focus on the global south. There is a need to create mechanism to support low and lower middle income countries specifically to face future health threats. India look forward to inputs from all member states and for productive discussion on how best can achieve concrete deliverables at our level and in close cooperation with G20 joint finance health minister stakes. Thank you. Thank you very much.
Thank you, India. Now, I'm delighted to invite our friend who is attending the meeting in this room, the Director General of the World Health Organization, Dr. Tedros, to deliver his keynote speech. Please, Dr. Tedros, the floor is yours.
Thank you very much. Your Excellency, Minister Budi, Excellencies, dear colleagues and friends, Selamat pagi. Good morning, and it's a pleasure to be here. And my thanks to my friend, Minister Budi, and Indonesia for your leadership and great hospitality. It's fair to say that the world is different now than it was when we last met in Rome last year. Reported cases and deaths from COVID-19 have now declined 90% from their peaks in January. In many of your countries, all restrictions have now been lifted, and life looks much like it did before the pandemic. Of course, there is progress, but the perception that the pandemic is over, although it's understandable, but misguided. Transmission is increasing in many countries, including some of yours, and this is despite the fact that testing and sequencing have dropped markedly around the world. And 40% of the world's population remains unvaccinated. The risk of a new and more dangerous variant emerging remains real. WHO remains very concerned that the lack of testing and sequencing is blinding us to the evolution of the virus. We're equally concerned that the lessons of this pandemic will go unlearned, and the cycle of panic and neglect will be repeated. Already, many other crises are dominating the attention of governments and the world's media. At the World Health Assembly last month, WHO presented a proposal for a new global architecture for health emergency preparedness and response. It includes 10 key recommendations for stronger governance, stronger systems and tools, stronger financing, and a stronger WHO at the center of the global health security architecture. One of those recommendations is for the creation of a financial intermediary fund housed at the World Bank. WHO and the World Bank estimate that $31 billion is needed every year for strengthening global health security. 2/3 of that could come from existing resources, but that leaves a gap of $10 billion per year. A flexible and agile FIF would help to close that gap. WHO has been working closely with the World Bank on what the FIF would look like, and we have listened closely to G20 countries in this process. Our proposal is that FIF would be overseen by a board that makes decisions about funding allocations supported by a technical advisory panel. Both the board and the technical advisory panel would be supported by a joint World Bank WHO Secretariat based at the bank's headquarters in Washington, with staff seconded from WHO. The bank would provide financial and administrative leadership in the Secretariat, operating as trustee for the FIF, holding and transferring donor funds, and providing administrative services. WHO would provide technical leadership, coordinating inputs for the technical advisory panel, and preparing relevant technical documentation, recommendations, and reports for the board. Both the bank and WHO would act as implementing entities along with other global health partners with relevant expertise, including the Global Fund, Gavi, FIND, CEPI, and others. And both WHO and the World Bank would be non-voting members of the FIF's governing board. Crucially, the governance of the FIF must be inclusive, with a structure that enables representation of all countries. And it must also be coherent with other parts of the global architecture for health emergency preparedness and response. That includes another of WHO's 10 recommendations to develop a new platform for the rapid development of and equitable access to countermeasures during future pandemics. This platform should be built on the experience of the ACT Accelerator, the Pandemic Influenza Framework, and other mechanisms. This is an important focus of the G20 health track under Minister Budi's leadership. Terima kasih, Minister Budi. So my thanks to you, Minister Budi, and to Indonesia, and to all G20 countries for your engagement and leadership in this process. We look forward to your feedback and to your active participation in building and financing a FIF that's inclusive, equitable, and effective in making our world safer from pandemics. I also thank you for your attention to TB antimicrobial resistance, the local production, and the necessity of a One Health approach. Because of disruptions to health systems during the COVID-19 pandemic, TB deaths rose last year for the first time in a decade. Reversing this trend requires domestic investment with international support to expand access to services for prevention, diagnostics, and treatment. But it also requires investments in research. We need effective vaccines, affordable rapid point-of-care diagnostics, and more effective, affordable, and non-toxic treatments, particularly for drug-resistant TB. Later this year, WHO is organizing a high-level summit to accelerate the development of new TB vaccines. We also appreciate your focus on antimicrobial resistance, and we look forward to discussing this topic with you at the event scheduled for August. To fight against both TB and AMR the fight against TB and AMR are perfect examples of the need for a One Health approach. For years, WHO has worked closely with the UN Food and Agriculture Organization and the World Organization for Animal Health as part of the One Health tripartite. Earlier this year, we officially became a quadripartite with the welcome addition of the UN Environment Programme. We look forward to working with our partners to support countries to implement our One Health Joint Plan of Action. One Health is one of the guiding principles of the new international agreement for pandemic prevention, preparedness, and response, which WHO's member states are now negotiating. Thank you once again for your commitment to protecting and promoting the health of your own people and the people of the world. Terima kasih. I thank you. And back to you, Minister Budi.
Thank you, Dr. Tedros. I believe everyone in this room and also in the video conference agree with me that you look much younger and much healthier with a beautiful batik shirt from Jogja. So now we will hear remarks from our colleague that has worked together, helping us during the pandemic, providing vaccine, therapeutics, and diagnostic tools. So we'll start with my friends who is already here, coming from banking sector, flew far away from Washington, Peter Sen from Global Fund. Please, Peter.
Excellencies, ladies and gentlemen, and my particular thanks to my colleague and fellow ex-banker, Minister Budi Sadikin, for your tremendous leadership and for the opportunity to speak. I'll make 5 quick points about health system resilience and pandemic preparedness, speaking from the perspective of the largest provider of grants to fight infectious diseases, the Global Fund. First, it's essential that our efforts to strengthen pandemic preparedness mobilize additional financial resources beyond current ODA. If we simply divert money from fighting existing diseases, including HIV, TB, and malaria, that will cost lives and deepen health inequities. Second, there are massive synergies between the investments to strengthen pandemic preparedness and our ongoing investments to fight infectious diseases. It's the same lab networks, supply chains, primary healthcare, disease surveillance, community health workers. Investing smartly to create multi-pathogen capabilities and surge capacities on top of disease-specific investments will enable countries to build pandemic preparedness on a marginal cost basis. So the proposed fifth must work through and with the agencies like the Global Fund that are already investing heavily in health systems. In our case, about $1.5 billion a year. A siloed approach to pandemic preparedness will be inefficient and unsustainable. Third, pandemic preparedness investments must be designed and delivered by the people on the ground, by countries and communities. So as Tedros says, we need an inclusive model of governance for the fifth, including these voices and as real decision makers, as is already the case with the Global Fund. Without local ownership and trust, we will not succeed. Fourth, just because we've been through COVID, we should not assume the next global health crisis will be another pandemic. Arguably, we're already in a new global health crisis, but it's the result of food and energy shortages and price hikes, not a new pathogen. Even if we evade the awful prospect of mass starvation, it seems inevitable that tens or hundreds of millions of people will be made markedly more vulnerable to existing diseases as a result of inadequate nutrition. So when we talk about reinforcing health system resilience, we need to think broadly and not be purely fixated on potential pandemics. Finally, the Global Fund's seventh replenishment, which President Biden will host in New York this September, will be a test of the world's commitment to save lives, free the world from pandemics, and build more resilient and sustainable systems for health, not just for the rich, but also the poor and marginalized, so we truly leave no one behind. We aim to raise $18 billion. With this, we can save over 20 million lives and increase our investment in health systems to about $2 billion per year. 20 years ago, the Global Fund was created in response to the last big pandemic to strike humanity, HIV/AIDS. Since then, we have made extraordinary progress against HIV, TB, and malaria, and the Global Fund has been playing a critical role in the global response to COVID-19. We count on your support as G20 members for the Global Fund's seventh replenishment so that together we can fight for what counts. Thank you.
Thank you, Peter. Next, I would like to invite the CEO of CEPI, my friend Richard Hatchett, who has the ambition that for the next pandemic, we will make the vaccine ready in 100 days. Please, Richard, the screen is yours.
Your Excellencies, ladies and gentlemen, Minister Budi, thank you for this opportunity to address you. In April 1815, Mount Tambora, located on the island of Sumbawa, 840 kilometers due east of Yogyakarta, erupted, blasting an estimated 100 cubic kilometers of magma into the atmosphere and killing more than 70,000 people in the greatest volcanic eruption in recorded history. Tambora's debris shrouded the planet for months and caused 1816 to be the year without a summer. A foot of snow fell in Quebec City on June 10th. Riots and looting broke out in Europe as harvest failed. Thousands of horses starved or were slaughtered as the high price of oats forced people to choose between their animals and themselves. Food prices soared and legions died from famine and disease. The eruption precipitated global economic crisis. Rebellions and uprising occurred from South America to Asia. But these crises also prompted innovation. Carl von Drais devised a personal transport machine to replace the horse, a device later known as the bicycle. The young Justus von Liebig, deeply affected by the famine, dedicated his career to plant and animal nutrition and made watershed innovations in agriculture, including the development of nitrogen-based fertilizer. New approaches to poor relief were pioneered in many countries. Like COVID-19, the fallout of Mount Tambora swept around the world. And like COVID-19, the crisis spurred innovation in the face of adversity. We cannot view COVID-19 in isolation. It emerged in a world where climate change, rapid urbanization, and globalization have increased infectious disease risk. It also fundamentally destabilized that world. Today, we face the war in Ukraine, high energy prices, the threat of global recession, and looming food insecurity that will impact hundreds of millions of people. That the challenges now stacking up emerged in the wake of the pandemic and against a backdrop of accelerating climate change is not a coincidence. The crises we face are linked. The COVID-19 pandemic has inspired radical innovations that were once thought impossible, like making safe and effective vaccines in less than a year. Now, global scientific, industrial, and political leaders have joined CEPI in working to compress vaccine development even further, down to just 100 days. But we cannot take our progress for granted. To secure the gains we've made, we must continue to evolve new and better countermeasures and build sustainable platforms to manufacture them. We need to make such investments while also investing in global surveillance and the health systems that deliver these products. The temptation not to invest properly in preparedness, given all the other crises we face, will be high. Investing certainly won't be cheap, except by comparison with the cost of not investing. Investing properly will also require a shift in mindset. That shift is already happening. I commend Indonesia's leadership for advancing the pandemic preparedness and response agenda during its G20 presidency, for supporting CEPI, and for its substantial contribution to the new Financial Intermediary Fund for Pandemic Preparedness. The fifth can play a critical role in the pandemic preparedness and response architecture of the future, but it must be fit for purpose. I call on the donors to the fifth to include CEPI, Gavi, and the Global Fund as implementing entities for the fifth from its initial phase and as part of its fundamental design. Inclusion of core global health organizations like ours with a demonstrated record in pandemic preparedness and response at the outset of the fifth would increase its ability to deliver on an accelerated schedule as well as its overall impact. In conclusion, as we look to the future, we must build on the gains made in the response to COVID-19 or leave the world vulnerable to a recurrence of the cascading crises we face now. To choose the latter course will dishonor us in the eyes of history. We stand at a crossroads. It is not an understatement to say that the decisions we make now will define the future course of our civilization.
Thank you, Richard. Last but not least, I'd like to invite the CEO of Gavi, my friends Seth. Seth is make it possible for Indonesia to receive more than 100 million doses of vaccine from COVAX scheme early this year and last year. So thanks, Seth, for your hard work and also providing access to vaccine from Indonesian people. So Seth, the screen is yours.
I would like to start by thanking the government of Indonesia for the floor. In addition, acknowledging the many G20 members who have generously supported the work of both Gavi and COVAX through the pandemic. The shared learning from the past 30 months must leave a positive legacy. The extent to which it does will depend very much on your deliberations. We are now entering a new normal of more frequent health emergencies. In response, we must rapidly identify where we have collectively fallen short and build on what has worked. We now see 48% fully vaccinated coverage across the 92 lower-income countries supported by COVAX, and vaccines have been the core response to almost all public health emergencies of international concern. We were fortunate that the Gavi Alliance partners had established relationships, could work together, identify gaps, and ensure a seamless end-to-end approach to getting jabs into arms. We must now really build upon these hard-won, pressure-tested solutions. The future architecture must be agile and networked and lead to greater collaboration, coherence, and complementarity between actors and agencies. With this in mind, we agree that the pandemic has exposed the need for more pandemic financing. We see a strong case for the planned Financial Intermediary Fund with Gavi, CEPI, and Global Fund as key implementers, and hope you agree. We hope you will also agree that the governance for such a fund must be inclusive with substantive, meaningful involvement by low and lower income countries. We have also learned that the rapid mobilization of risk-tolerant financing is critical in health emergencies. The fifth must play a role in an integrated part of a bigger picture with other instruments such as the pandemic vaccine pool and IFM also playing a role. An equally important part of the picture is the system-strengthening work of organizations like the Gavi Alliance in between pandemics. In fact, about 70% of our current phase funding helps build PPR capacity in the countries where we work. This week at the Gavi board, we're discussing how better we can support new vaccine manufacturing and market shaping, particularly in Africa. All of this reinforces the need for coordination. ensuring the allocation of scarce resources is based upon rigorous and candid needs assessments. The progress made by the G20 Joint Finance Health Task Force has shown the need for ongoing dialogue between these ministers and ministries. Calling back to the findings of the G20 high-level independent panel, ongoing PPR assessment with oversight by health and finance ministers will be critical for both accountability and resourcing. This calls for a sustained secretariat, including a range of agencies, with an independent chair for impartiality and candor. We look forward to supporting ministers in considering these issues further and again express our appreciation to the chair for the opportunity to input. Thank you.
Thank you, Thas. Distinguished guests, ladies and gentlemen, because we are very excited to talk in this meeting, so we just passed the time a little bit. So I would suggest that we change the coffee break, that the coffee will be sent to your table. And we will continue this meeting to the first sessions. The first session will be the strengthening global health architecture. And thanks to the team, Peter and Richard and also Seth. These are three out of many institutions that quietly has worked together with the coordination of WHO, and without realizing it, we are actually